You're watching Let's Chat.
One of the best parts about doing this job, my job, is I get to introduce you, or in some cases reintroduce you, to hidden jewels in our community. People who go way above and beyond and make sure life is better for everyone. Our first guest this morning is just such a crown jewel. It is right here. She is right here. This is Ray Bond with the Chattanooga-Hamilton County Medical Society and Project Access. Ray,
yes.
Great to see you as always.
It's great to see you, Chip.
What you guys do at the Medical Society and Project Access has provided health care for untold tens of thousands of people.
It has.
And you have brought into your fold doctors from just about every medical specialty under the sun, or maybe each and every medical specialty under the sun. Now you're expanding this whole thing. So we're going to focus a little bit about Project Access.
Great.
And before we get into the big news about it, tell folks who may not know what Project Access is. Tell them what it's all about.
Sure. Project Access is a coordinated charity care network that provides specialty care and hospital services for low-income, uninsured neighbors in our community, and now we're expanding our scope a little bit to Bradley County.
One of the things about Project Access is, in many cases, this surgery or this medical procedure was not an elective situation. It wasn't a, it'll make my life a little better by whatever. This was saving lives.
It's the program has, our volunteer physicians have saved people's lives. It saved people's eyesight. It's provided the care that they needed so they could continue supporting their family, continue working, and it's just really a miraculous gift to our community.
It really is. Roughly how many physicians are in, I won't say your network because that sounds too much like an insurance thing, but how many physicians and healthcare pros roughly are in your Rolodex? So
we have over 1,100 volunteer physicians.
Wow.
And Erlanger Memorial, Park Ridge, and now Chenova Hospital in Cleveland are all part of our coordinated care network. It's amazing.
And the beautiful thing about what you were doing, and I remember you and I talking about this several years ago, is you said, what we've done here is good, but I want bigger and I want better and I want more. So you're able to do that now. You are expanding into Bradley County.
Yes, we are. We've recruited physicians who are based in Bradley County to join our Merry Band, and Chenova Hospital in Cleveland has agreed to partner with us. And then we have some of our practices that were already part of our program who also have offices in Cleveland. So we have begun enrolling some folks over there, and we're really excited to make this offering to that community.
How has the reception been throughout Bradley County when news got out and the word started rolling out about, hey, Project Access is coming here? I
think it's safe to say there was a huge amount of excitement. We actually started working on this about 2 years ago, and then of course a little thing called COVID hit, and so we sort of had to put some planning on hold. So we've been working with the Bradley County Health Department, with the Tennessee Department of Health, and then of course with Chenova, and with a wonderful group of volunteer physicians who are based in Bradley County.
Whether it is Bradley County or Hamilton County, what does somebody have to do in order to qualify for Project Access? Well,
the program is for people who have a current health need, who are uninsured and don't have access to insurance, and who have income at 150% of poverty or below. And for an individual, that's a little over $20,000. It's about $35,000 for a family of 3. And so it basically be uninsured, have a health condition, and meet the income criteria.
And there are so many people that you are able to help that, through no fault of their own, just seemingly fall through the cracks when it comes to getting adequate and, in many cases, life-saving health care.
Yeah, and we have many of the patients work, but a lot of them might have 2 part-time jobs, or they're in jobs that don't really offer employer-based health insurance.
Right.
And so, and there are some folks who just don't qualify for different programs. So we serve a wide variety of people. A lot of our folks are older. They're sort of 55 plus, and many of them have worked all their lives and actually had employer-based health insurance. But if they got downsized or have, for whatever reason, lost their job. A lot of times they suddenly, for the first time, are without health coverage.
If there are physicians watching, and I know there are, or their families or healthcare companies who you haven't approached yet that want to get involved in the great things that Project Access does, how do they get enrolled? How do they come to you and go, hey, I want to help?
Well, our website is www.hcprojectaccess.org. Or you can call the Project Access number is 826-0269. And it's easy to do, it's easy to connect to. We'll explain everything, we'll help folks set it up in the system. And all of our patients, we verify their eligibility.
Right.
You know, we coordinate the care. We have a whole staff of folks who ensure that people make it to their appointments on time, the follow-up if they need any tests. So we make it as easy as we can
and by
for the
extension,
physicians.
Not just for the patients, but you're also treating their families indirectly. And it's certainly a wonderful, wonderful thing. And you probably heard before that most of us are only one catastrophic illness from going from the proverbial penthouse to the outhouse. Keep up the good work. You'll be coming back and joining us more over the coming weeks.
Thanks.
Ray Bond, check her out. She is a wonderful, wonderful individual and spearheads a wonderful, wonderful group. Stay with us. We'll be right back after this.
Thank you.